We can have pain on the inside of the knee, on the outside of the knee, around the kneecap, around the patella, in the back of the knee. We can have Baker's cysts. Lots of different things in the knee can cause pain and dysfunction. So the knee is a complex joint in the body. It is designed to have flexibility, but it also needs to have stability in order to help us with the gait cycle. Because it's where two big bones come together, we have natural shock absorbers and cartilage in between the bones to help cushion. We also have a lot of supporting structures, ligaments, which are like kind of like rubber bands that hold the bones together. We also have tendons and muscles that also run close to the joint to help provide stability and motion. Each of these parts can become damaged, either through sports injuries, through arthritis, through wear and tear, and the knee can present a lot of pain and really make enjoying life difficult. Oftentimes when we have pain in the knee, it's very common in this country that we see pain in someone who's 40, 50, 60 years old that is caused from arthritis. Basically, we've had too much wear and tear, we have some cartilage loss, and we're getting too much compression between the two bones in the knee. We can also get damage to some of those shock absorbers inside the knee, the meniscus. When these meniscus become damaged, they can become frayed, they can have tears, they can break loose, and oftentimes this can lead to rather significant pain. This is oftentimes seen in athletes where you'll have somebody that has a meniscal injury. Some conventional wisdom says that if the meniscus is damaged, we want to remove it, but that alters the biomechanics and that leads to problems later on. And so if there's a way that we can heal the meniscus of the knee naturally, we want to do that. The same thing happens with cartilage loss. As we start to have too much wear and tear on the knee, we do start to break down the cartilage, and that leads to pain and degeneration, and sometimes can culminate in requiring a knee replacement. But commonly what I find is that a lot of knee pain is related to altered biomechanics, and meaning that trauma that has happened at some time or injury that has happened at some time, and it may even be years ago, it may be in your youth when you were doing an activity that you don't even remember. What can happen is we alter the biomechanics of the joint, and so we're not wearing the weight equally as the knee was designed to bear weight. So what happens if you're not bearing weight the way it was designed, we start wearing on one part of the knee. So then you start to get wear and tear on one meniscus, or we start getting cartilage loss on one side of the knee. And so fixing the biomechanics seems to be the key to naturally helping patients recover from knee pain. The way I do that in my practice is we typically use regenerative injections. There's two primary types: prolotherapy, which uses a dextrose, which is a sugar compound that we inject into the ligaments. That causes inflammation, but that helps the body come in, break down the damaged ligaments, and then lay down new ligamentous tissue. A more advanced form of prolotherapy is what we call PRP, platelet-rich plasma, which is where we draw a blood product out from you, we spin it down, we take out the platelets and the growth factors, and we inject those healing substances right into the damaged tissues. This is very effective. This helps the tissues to regenerate. This can help with meniscal injuries, and this can help with those weakened ligaments in the knee. Finally, we also have stem cell treatments. There's many ways these are being done today. Some of them are using umbilical cord from donor umbilical cords. The stem cells are extracted, and those can be injected into the knee, and there's some evidence that seems to suggest it can help with cartilage regrowth and meniscal regrowth. Sometimes to get stem cells, we can use adipose tissue from the patient. So we would go in, we would harvest some adipose tissue from you, we would spin it down, we'd take out the mesenchymal stem cells and inject those into the knee. And then finally we have bone marrow, where we would go in, numb up the area, we would extract out some bone marrow, we spin that down, and then we inject those stem cells from your own bone marrow into the knee. And so there's a lot of different treatments that we can do for knee pain to help with knee arthritis, with knee degeneration, meniscal injuries, and cartilage loss.